Hi, I'm Dr. Steve Feldman, candidate for the U.S. House of Representatives here in North Carolina's 10th Congressional District. I want to talk about health care. There is no perfect healthcare system because we don't have unlimited resources. Our current third-party payment system provides miracles, but it's extraordinarily costly and not accessible to everyone. As a physician caring for patients, I see how the limitations of our current system lead to higher cost and poor access. A key problem is that patients don't have an incentive to choose low-cost options. I remember very well a well-insured patient who had a skin rash that could be treated with a $4 generic cortisone cream or a less messy $200 cortisone spray or an $800 tube of a new ointment medication that may have been a little bit better. I offered the patient all three options, and I think you can guess which they chose. The patient said, "Doc, give me the $200 spray and the $800 ointment. I'll try both and see which I like better." When patients don't have any direct incentive to use healthcare resources wisely, costs are going to go up. Healthcare providers like me and drug companies have little incentive to keep prices down when a third party is paying the bill. In the face of these higher costs, insurers, lacking unlimited resources, are forced to ration care. Moreover, the resulting high prices make healthcare unaffordable for the uninsured, and it makes health insurance premium costs a huge burden on individuals and employers. Now, a government-imposed single-payer system that provides free care would help assure care for everyone, but it would limit choice, and instead of the insurers rationing care, the government would have to ration care. Plus, free healthcare isn't free. It's paid for by taxes, or worse, by laying more debt on future generations. My preference is to encourage use of market-based incentives to drive down healthcare prices. Markets give people incentives to choose lower-cost options, creating competition that would reduce healthcare prices and give providers incentives to improve quality. If patients were paying the bill from their own wallet, they'd call around to see what prices were at several offices before making an appointment to see me. And that would force healthcare providers like me to offer services at reasonable prices. And we probably couldn't keep patients waiting an hour either. If elected, on day one, I'd like to introduce legislation giving Americans back their freedom to purchase medications from wherever they want, without government restriction. Some of the medications my patients need are generic, yet still are very, very costly. These same medicines are very affordable in Canada and Mexico. People should have the freedom to get their medication from wherever they want, and the responsibility to choose wisely. More generally, converting government-funded health programs to high-deductible plans with health savings accounts would give people an incentive to seek lower-cost care. It would also create competition to reduce healthcare prices. I would advocate for freeing the states to try different approaches to regulating health insurance. This would allow us to see the pluses and minuses of each approach and base our future decision on facts. Drug costs are high. The Food and Drug Administration is well-meaning, the FDA, but its rules and restrictions add unnecessary time and cost to the development of medications. And that limits the access of patients who might benefit from these drugs now. I specialize in psoriasis, and there are new, very promising pills in development that are years away from FDA approval. Many patients might like to take those pills now. I would like to introduce legislation that changes the FDA from a compulsory organization to an advisory one. This would give companies greater freedom to innovate, and the FDA could still give us the information the FDA thinks we need to make informed choices about our health care. People would have the freedom to take a drug the FDA hadn't yet approved, and the responsibility for their own health decisions. Some people advocate Medicare for all. Look, let's allow people who want Medicare to pay the premium and use Medicare if that's what they choose. These are my personal preferences, but they will not create a perfect health system. Some people might choose less care than others think best. I think that should be their right. We don't have unlimited resources, so whatever approach we choose, there will be trade-offs. There is no perfect healthcare system, but together we can work towards one that's better than the one we have now.
Paid for by Feldman for Congress.